Nasal hemangiomas are benign vascular tumors that arise from the blood vessels of the nasal cavity. These tumors can occur in the external nose, nasal mucosa, or paranasal sinuses. While they are most common in infants and young children, nasal hemangiomas can also be seen in adults. Although benign, their location and potential to cause complications make them clinically significant. There are several types of hemangiomas, each with distinct clinical presentations. Infantile hemangiomas are the most common and appear shortly after birth, growing rapidly in the first year of life. Most of these regress spontaneously by age 5 to 7. Congenital hemangiomas, however, are fully formed at birth and do not grow after birth. The most common subtype is the capillary hemangioma, composed of small, densely packed capillaries. On the other hand, cavernous hemangiomas consist of larger, dilated vascular spaces, grow more slowly but can become quite large. Several factors are implicated in the development of nasal hemangiomas. Genetic mutations may predispose individuals to these lesions, and estrogen likely plays a role, as hemangiomas are more prevalent in females. Hypoxia also contributes to the development of hemangiomas. In low oxygen conditions, levels of vascular endothelial growth factor, or VEGF, increase, promoting the proliferation of blood vessels. In the proliferative phase, the endothelial cells of hemangiomas undergo rapid growth, forming a vascular mass. This is followed by the involutive phase, where the hemangioma regresses and many blood vessels are replaced by fibrotic tissue. Externally, nasal hemangiomas often appear as raised, red or purple lesions on the nasal bridge. Internally, nasal hemangiomas can cause nasal obstruction, recurrent epistaxis, and breathing difficulties. In more severe cases, there may be nasal swelling or even deformity. To diagnose nasal hemangiomas, a thorough history and physical exam are essential. Imaging plays a critical role in determining the extent of the lesion. MRI is particularly useful for evaluating deeper structures, while CT scans are important for assessing bone involvement. Doppler ultrasound can help assess blood flow within the lesion and differentiate it from other masses. In most cases, biopsy is not necessary, as hemangiomas have distinctive histopathological features. Management of nasal hemangiomas varies depending on the severity of symptoms. Observation is often appropriate for infantile hemangiomas that are likely to regress spontaneously. However, when treatment is required, beta blockers, particularly propranolol, are now first-line therapy. Propranolol works by constricting the blood vessels and reducing levels of VEGF. Corticosteroids were previously used, but are less common now due to the success of beta blockers. In cases unresponsive to medical therapy, interferon alpha or vincristine may be considered. Surgical intervention is reserved for cases with significant bleeding, airway obstruction, or cosmetic deformity. Depending on the hemangioma's size and location, surgery can be done endoscopically or via an open approach. Laser therapy is another option, particularly for superficial lesions. Preoperative embolization may be used to reduce bleeding during surgery. The prognosis for infantile hemangiomas is generally favorable, with many cases resolving on their own. However, in complicated cases where there is nasal obstruction, bleeding, or significant deformity, timely intervention is crucial. Complications can include severe bleeding due to the vascular nature of these tumors, secondary infections and ulcerated lesions, and cosmetic deformity, which can be permanent if untreated. In summary, while nasal hemangiomas are benign, they can present significant challenges due to their location. Early diagnosis and appropriate treatment are essential, particularly in pediatric patients, to prevent complications and ensure the best outcomes.